My name is Zahar Al-Bashabshi. I am a PhD student. Today I will talk about evaluating the effectiveness of nutrition education methods for WIC service clients in Manhattan, Kansas. So I did this study last semester in the WIC program. So the outline of my presentation are WIC program background, nutrition education, and then goals of nutrition education, certification process, and nutrition education methods, rule of behavior change theories, methodology, and finally conclusion. But before I start talking about the outline of my presentation, I would like to talk a little review why I did this study. I did this study because evaluating the effectiveness of nutrition education has not been reviewed significantly. So the question is, why we need effective nutrition education? We need effective nutrition education because, as we know, unhealthy dietary patterns are common over all social economic status, but the highest prevalence is among low-income people. Low-income people are less educated and eating less fruits and vegetables. Therefore, we need healthy nutrition education to increase low-income people knowledge about healthy food choices. That's why we need effective nutrition education. Okay, first I will talk about WIC program background. In response to the concern over malnutrition of poverty vulnerable groups represented by women and children, WIC program was established in 1974. So, WIC, what is the WIC? WIC is a supplemental nutrition program designed to improve pregnancy outcome, promote health of pregnant, delivered women, infants, and children under the age of 5. And this can be achieved through the 4 core services of the WIC program, summarized in nutrition education, breastfeeding support, checks to buy healthy food, and health care referrals. This table shows the number of participants and the funding level for the WIC program from 1980 to 2030. As you can see here in this table, the number of participants and the funding level from 1980 to 2010 increased, but from 2010 to 2030, the number of participants and the funding level decreased, and this is because due to the budget limitation. So, WIC program provide foods for the low-income people. So what are these food? First, these foods are infant cereal, iron-fortified adult cereal, iron-fortified infant formula, vitamin C, eggs, milk, cheese, peanut butter, dried and canned beans, and finally canned fish. All of these food contain vitamins and minerals that are needed for the proper health. That's why the WIC program provided these foods, especially for the low-income people. So, who is eligible for the WIC program? In order to be eligible for the WIC program, the client must meet the following criteria. First, the client must be pregnant women. Second, breastfeeding until 1 year. Non-breastfeeding until 6 months. Third, have a child under the age of 5. And fourth, clients who are at nutritional risk. And finally, meet income guideline. If the income of the client less than 185, then the clients are eligible for the WIC program. If the income more than 185, then the clients are not eligible for the WIC program. Nutrition education, one of the most important, as I said before, one of the most important services for the WIC program is nutrition education. So what is the definition of nutrition education? Nutrition education is any combination of education strategies with a community to help it know about the risk and how to reduce these risks. What is effective nutrition education? Effective nutrition education, we can say nutrition education is effective when it results in a positive behavior change. So the effective nutrition education should elicit the behavior change to improve nutritional style of the clients. So what are the goals of nutrition education? The first goal is emphasize a good relationship between nutrition, physical activity, and health. The second goal is assist the WIC clients who are at nutritional risk in achieving positive change. And the third goal is prevent nutrition-related problems. So the WIC program So in this study, I need to evaluate the effectiveness of nutrition education. The WIC program offers nutrition education in 3 methods. Okay, the first method is online education. The second method is interactive notebooks, and the third method is individual counseling. Anyone know about these methods before?
Online education is normal, I think.
Yeah.
Yes, for different kinds of majors, we all have the online classes. I think that is one part of the online education.
Right. So what about the second method, interactive notebooks? Anyone know about this? Anyone can give me example about this method?
Is notebooks is a real notebook or the computer notebooks?
Anyone? Okay, what about the third method?
Maybe it's like have an advisor and you can get the information and the knowledge from that person.
Yeah, okay. I will explain all of these methods now. Okay, the first method is online. So the WIC program, there is a website for the WIC program. This is the website, wichealth.organization, to help the WIC staff to follow up with the clients. Okay. This is the first method. The second method is interactive notebooks. Interactive notebooks such as posters or videotape or pamphlet or newsletters. These teaching aids used to reinforce a client's understanding. Okay. The third method is individual counseling. Individual counseling, for example, face-to-face meeting, and in this method, the dietitian staff in the WIC program uses their critical thinking skills when they are developing nutrition education message. So this is the 3 methods used by the WIC program. Now I will talk about the certification process. New applicants and existing clients must go through a certification process. The time period for the certification process is 6 months. So every 6 months the client need to recertify to make sure that he or she eligible for the WIC program. During the certification appointment, the WIC staff perform a health and nutrition screening, for example, measuring the body weight, the length, measuring the hemoglobin, something like this, okay? And finally, the clients receiving 2 nutrition education sessions during the certification time. As I said before, the time period for the certification process is 6 months. So the client receiving 2 nutrition education sessions. The first session, it's called a primary or initial nutrition education, and this education provided at the first day of the certification process. Okay, this is called initial nutrition education. The second one, it's called secondary nutrition education, and this is education provided 3 months or 2 months later after the first day of the certification process. Okay. Anyone hear about the WIC program before? No? We have a WIC program here in Manhattan. Yeah. It's close to Lafayette Center. Yeah, it's close to Lafayette Center, and this WIC program provide nutrition education for the low-income people. Okay. I thought that you have idea about the WIC program. Okay. So in this study, we used a trans-theoretical model. Okay. So we used the trans-theoretical model. Why? We used a trans-theoretical model. We used the trans-theoretical model to identify the readiness of clients if they are able to change their behavior or not. Okay. So the trans-theoretical model, there are 5 stages for this model. The first stage, it's called a pre-contemplation. The second stage, it's called contemplation. The third method, it's called preparation, and the fourth method is action, and the 5th method is maintenance. Okay. Pre-contemplation, it means that the client has no intention to take action in the next 6 months. But contemplation, the clients intend to take action, okay, within